So we do see that there is a strong neurological component to stabilization, which overrides the biomechanics. The biomechanics subserve the neurology. The ability of the muscles to quickly be facilitated into the required stiffness is much more important than the ability to generate a sufficient biomechanical bolster that would stop the spine from moving in an unwanted way during the execution of a movement. If that was the case, we would have very limited movement repertoires because the relationship of the diaphragms would have to be fixed, and we would know that if that relationship became too disturbed, there would be an automatic fail of the stabilization system, and therefore a loss of strength, a loss of posture, and the possible immediate risk of injury.
That's that's interesting. That's an interesting way to think about it, because you're saying the fact that there is a wider range of motion available to us is ultimately the proof that we can effectively stabilize those positions or postures. Because if we weren't capable, again, evolution wouldn't have allowed us to even get to the point where we can move.
I know.
Or we would have anybody who moved there would have broken down and not passed on their genes, essentially.
That's right. That's right. I mean, because without that flexibility, evolution is your chances of survival are not very good. I mean, let us face it, any animal not only has to deal with the natural environment, but there are many animals that must deal with artificial environments that they were never evolutionally equipped for. But yet they surmount those challenges because there is resilience in the system and there's flexibility in the system. The same ability that allows an octopus to get in and out of a marmalade jar, which is not something it has ever encountered in its evolutionary life. I mean, come on. Twist on, twist off.
It is amazing.
Twist on, twist off lid on a jar is nothing that nature actually prepares an octopus for. But yet it is able to find its way because it is adaptable. We have developed movement repertoires that allow us to skateboard, do the half pipe, dance, do parkour jumps, an amazing array of movement scenarios which defy the parallel relationship of diaphragms. It just does. And yet it is possible to generate enough force to complete these complex movements without injury.
And again, in one sense, without injury over time is definitely, an output factor that should be considered. If somebody is constantly getting injured, then you can reliably say that, the pattern that they're using is probably not the most effective.
That's right.
But the other idea is you can't necessarily just simply rely on injury. No. You have to still do your pre and post assessment.
Right.
Yeah, you have to still do the audits.
That's right. Yeah. So we do see that there is a strong neurological component to stabilization, which which overrides the biomechanics. And as I've always said, the biomechanics subserve the neurology. The neurology is paramount. Why? Because it is a living, breathing entity. We're not talking about dead tissue, dead levers, etc. We're talking about the ability of a brain to make decisions, to change leverage systems, to tighten, loosen joints, to change muscle tone in an instant. These factors, the biotensegrity factors that allow for minute and major adjustments of the biomechanical efficiency or effect, is what puts us apart from mechanical objects, constructs that have no living brain to oversee their movement patterns.
Yeah, I mean, it's, I guess that, and then using that the model that we've set up of auditing being essentially the only way to really tell if something is of quality or not. That is ultimately how we're going to test whether or not somebody is stabilizing effectively, utilizing the strategy of breathing and production of intra-abdominal pressure. We can look at it visually. We can even feel it to see if the stereotype that we're looking for is happening. But ultimately, we still have to globally assess them before and after to really tell whether or not that strategy was effective. Because people can fool us. I mean, we can look and say, "Oh yes, that looks very nice," and then you reassess them, and nothing changed or it worsened.
That's right. Yes.
And that would ultimately tell us that what you just did either wasn't enough or was poor.
And there is a technology on the way that may help us better. There's portable ultrasound, which will give us another insight into the tissue function. For instance, these new ultrasound machines that are so highly portable may show change in fascial motility or mobility pre and post movement.
Dear God.
There are sensors that, for example, you see in movement and weight bearing that can track force production or reactive force, so that you can say, yes, you're landing more heavier on your left leg than you are on your right during your running or your jumping. All these things are coming down the line, and they will only help us be more accurate in our assessment. But
they'll give us more standards. They'll give us more benchmarks.
Give us more standards. Yes,
to say,
that's
we
right.
know that you need to hit this amount of pressure or this amount of contraction or a load at that area in order to be effective.
Yes, but the basics will always remain the same. Do we have an easy, sensitive measure by which we can get a global read on the patient's, on the price that is paid for the movement? That is what we're assessing. What is the cost of this movement? And ideal movement is the one that costs us the least, whilst it is being still effective. That is what ideal movement basically is. It is the least costly movement that has the greatest effectiveness. That is it. So if we can get parameters that can prove to us that this is the case for this individual, then we're good to go.
Yeah, that would obviously make it a little bit easier and make it easier for the patient, because it's feedback. Essentially, it's some type of biofeedback, something that they can point to and get at.
Yeah.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.